A general orthopedic surgeon to patient ratio in India is just 1 by 62,000. This ratio can become even smaller for subspecialties like complex bone deformity correction.
Complex bone deformity correction requires special skills like assessing the bone deformity in 3D, correcting the bone deformity based on well-researched principles which can include accurate resection of the bone, accurate repositioning of the bone segments, and then accurately fixing them with a suitable implant like a bone plate or a rail fixator or an Elizarov or a intramedullary nail. Depending on case-to-case basis, this can become even more complex.
Now, the only option for trainees to get trained in these complex skills is to work with an expert surgeon, assisting them in real patient surgery because there are no cadavers and no training system available. Now, since the expert surgeons themselves are very low in number, very few surgeons get trained in complex deformity surgeries. Now, this affects patients a lot. Patients who mainly come from low resource regions, they do not get the treatment. A local surgeon is not able to perform the surgery very accurately and they often make mistakes. To get a better surgery, or sometimes patients have to go for revision surgery, patients have to move to a faraway places, cities or even countries. For example, many African patients come to India for deformity correction surgery treatments. To solve these problems, that is to train more and more surgeons for complex bone deformity corrections, we are developing OpenSurgiSim. It's the world's first low-cost, easily available, easily reproducible training simulator for surgeons to get trained into complex deformity corrections without a need of an expert surgeon. Now, OpenSurgiSim has three parts. First is cognitive training part, second is psychomotor training part, and third is self-assessment automatic system. The cognitive skill training will be given by 3D interactive surgery simulation of various real-life bone deformity cases. Trainees will access these simulations using our free available web software and learn how to plan or perform any deformity correction based on principles of deformity corrections.
The psychomotor skill will be acquired by trainee surgeon by performing surgeries on a 3D printed bone model. These bone models are intelligently designed as a kit of modular bone parts. These modular bone parts can be assembled together to create any deformity case. As these cases are modular, some parts of this are consumables and some are reusable. This brings down the cost of 3D printing by 3 times. The 3D files of this kit can be downloaded easily from the web software.
Now, to guide the trainee during the psychomotor training, we have devised an innovative web camera based AR system. The trainee will perform the surgery on the bone models under the vision of a web camera that is connected to the PC which is running our web software. The AR system will display all the necessary guidance and feedback as an overlaying information on the webcam feed. A repetitive training with a real-time feedback will induce necessary psychomotor skill in the trainee. The automatic assessment of the training will be given by the same AR system. It will evaluate the resulting corrections on the 3D printed bone model based surgeries based on any quantitative and qualitative measure. Hence, there is no need of any expert surgeon to guide or assess during the training. So this way, OpenSurgiSim system will train any orthopedic surgeon at low cost using just a simple webcam, 3D printed bone models and our freely available web software anywhere in the world without a need of any expert training surgeon. Our team has experienced and world-renowned surgeons and educators in the field of deformity corrections. We also have entrepreneurs which are recognized for their innovative work by top world organizations like Y-Combinator. Our team has been already working together for years and have developed many innovative surgical solutions. With such an experience and capabilities, we are very sure to make a great impact with our proposed solution in the world of surgery training. Please support us to build the world's first low-cost surgery training simulator to upskill any orthopedic surgeon in the world to become an expert in complex deformity correction.